Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I teach on things that we're currently doing in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 25-year-old male presents with a 12-hour history of sharp, crampy abdominal pain that is localized to the right lower quadrant. He reports nausea, decreased appetite, and mild fever. On examination, you notice tenderness at McBurney's point and a positive rebound tenderness. What is the most likely diagnosis and the next best step for confirmation? Is it A, gastroenteritis and an abdominal ultrasound, B, cholecystitis and an abdominal CT, C, appendicitis and an abdominal CT or ultrasound, or D, diverticulitis and a colonoscopy? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis and the next best step for confirmation, right? I tell you, if they're looking for a diagnosis, you need to run it back and look at the assessment findings. So this is a 25-year-old male. He's had a history for the past 12 hours of sharp abdominal pain, is crampy, and is more localized to the right lower quadrant. Right. So when we're starting to think about right lower quadrant, we should be thinking about appendicitis, right? That's a common area where we may have these symptoms, but let's continue. On exam, the nurse practitioner notes tenderness at McBurney's point and positive rebound tenderness. Now that's confirmation right there, right? Of appendicitis. So your best answer is C, appendicitis, and we can do an abdominal CT or ultrasound, okay? Question number two. A 40-year-old female with a history of obesity and diabetes presents with a 24-hour history of right upper quadrant abdominal pain, fever, and nausea. The pain worsens after eating fatty foods. On examination, she has tenderness in the right upper quadrant and a positive Murphy sign. What is the most likely diagnosis and what test is most appropriate to confirm it? Is it A, appendicitis and an abdominal CT, B, cholecystitis and an abdominal ultrasound, C, ulcer disease and an upper endoscopy, or D, pancreatitis and serum amylase and lipase? Take a moment and tell me what you got. All right, so here the stem of the question states, what is the most likely diagnosis and what is the test that is most appropriate to confirm it? So again, we're looking for a diagnosis, right? So run it back and look at those assessment findings. We have a 40-year-old female. She has a history of obesity and diabetes, but her chief complaint is for the past 24 hours, she's had right upper quadrant abdominal pain. Number one, that should start to make you think cholecystitis. The fever and nausea, yep, that is more commonly associated with cholecystitis symptom wise, I should say. The pain worsens after eating fatty foods. That's another check mark for something with cholecystitis. Now, on exam, nurse practitioner notes tenderness at the right upper quadrant and a positive Murphy sign. Murphy sign, we know, is that definitive test for cholecystitis. So all of these check the boxes. So you should go with B, cholecystitis, and an abdominal ultrasound, okay? And then lastly, question number three. A 65-year-old male presents with left lower quadrant abdominal pain, fever, and constipation for the past 3 days. He also reports nausea but no vomiting. On examination, there is tenderness in the left lower quadrant with no rebound tenderness or guarding. Lab tests show mild leukocytosis What is the most likely diagnosis, and what imaging test should be done and used to confirm it? Is it A, diverticulitis with an abdominal CT scan, B, Crohn's disease with colonoscopy, C, acute appendicitis with an abdominal ultrasound, or D, irritable bowel syndrome and complete some stool studies? Take a moment and tell me what you got. All right, and the stem of the question here states, what is the most likely diagnosis and what imaging test should be used to confirm it? All right, so looking for those assessment findings. It's a 65-year-old male, chief complaint of left lower quadrant abdominal pain. So again, when we think about left lower quadrant abdominal pain, we're thinking of diverticulitis. Also with the nausea, the vomiting, on exam, the constipation, all symptoms of diverticulitis. Rebound tenderness was ruled out, but there is some tenderness to that left lower quadrant. So your best answer is A, diverticulitis and an abdominal CT scan, okay? All right, you guys, and if you struggle with any of those GI locations, diagnostic exams, the classic presentation, and treatment. I do have a video on that. Just go to the playlist and you'll see it. It has its own category, okay? But as always, you guys, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option, the self-paced review course for family and adult Gero. And then if you're looking to do any practice questions, my QBank options, as well as my digital flashcard options are all linked in the bio of this channel. And then if you're looking to book any one-on-one sessions with me, I always say either call, text, or shoot us an email as I offer a variety of one-on-one session types. So I like to speak with you first to gauge what you are really needing to make sure that you're booking the appropriate session, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.